Good morning, Jamaica. My name is Mrs. Shuwana Benjamin from the Southeast Regional Health Authority, Public Relations Manager, and I will be your host for today. This week is being observed as Renal Week from March the 8th to the 15th, and we have a special guest to speak to us today about what is happening for Renal Week. So our first speaker is Dr. Kimone Young, medical doctor at the Kingston Public Hospital, and 2025 Cosmos Queen of Jamaica. Hi, good morning, Dr. Young.
Good morning.
We're so happy to have you today.
Thank you for having me today.
Also, belated Happy International Women's Day to you.
Thank you. I had such a good time yesterday.
Awesome.
Happy belated International Women's Day to you as well.
Okay, let's get back to the topic.
Right,
Renal Week. Can you tell us what Renal Week is for those who don't know? And what are the activities that are being planned at KPH to commemorate this week?
Okay, so the first thing is that renal means kidneys. So this is a week where internationally we celebrate all persons who fight kidney disease, and that usually is chronic kidney disease. So you may have had some abnormal numbers before and you're now going to a kidney specialist to be able to treat it. We'll call it chronic kidney disease. So Renal Week is a week in which we celebrate those who are fighting kidney disease, and we provide health education and awareness to prevent those who are at risk of getting kidney disease. So what is KPH doing for this?
Right.
Firstly, it's all across Jamaica, so it's not just KPH, but as KPH's representative, we started yesterday at a beautiful church service just to anoint the week and to also remember that wellness holistically also involves spiritual health. So we started at a joint church service in Mandeville yesterday. Today is a little bit of a rest day for us at KPH, a little final planning and logistics working out. Tomorrow at KPH, we're going to have what we call a P drive. You get it? You get it? P?
Yes.
You ready? So it's the Prevention, Education and Empowerment Drive. And that is where we allow the patients themselves to tell us their own journey, create a poster, and then they educate other persons of the public with their own journey about kidney disease. So that's the P drive. We have educators from nephrology who are going to come and judge them and give them a grade, and we're going to award them after. On Wednesday, we're going to have corporate and public impact. We're going to go into the corporate institutions. That will be virtual. We're going to go to Jamaica Energy Partners. They have been partners with our unit before. They had renovated our Peace Gardens.
Nice.
So we're going to go back to them and give them even more information. And we're also going to go to the St. Andrew Technical High School.
Woo.
You went there?
No.
Oh, okay. We're going to go to the St. Andrew Technical High School, and we're going to speak to the teachers about kidney disease, and hopefully we can leave some information as well for the students. Then on Thursday, on the Thursday, which is March 12th, World Kidney Day, KPH, also with our 250th anniversary, we're going to be having a health fair. We're going to have screening, we're going to have music, we're going to have information, and we're going to give you a walk through kidney disease. As you come to this health fair, you should, and you will be, equipped with all the necessary things you need to be able to tackle kidney disease. We're going to have little treats, we're going to have games and giveaways, but we're going to screen you. So know your numbers, blood pressure checks, sugar checks. We're going to check for your cholesterol, your lipids. We're going to check for something called uric acid. If you don't know what that is, you come on Thursday and you find out.
Nice.
Then on Friday, we're going to have a national P drive. So we're going to have all the different dialysis units coming together with their similar poster to be able to share even more awareness. We have a nice break and pause on Saturday, cool down. And then on Sunday, KPH is going to have a nice banquet to award both staff and patients for all their time, their hard work, and their dedication.
Wow, a lot was said.
A lot was said.
A lot was said, which is very good. I see that there are a lot of, activities and, thoughts being planned into the whole activities. Can you just explain for maybe persons who would have missed it, why is early screening for kidney disease very important?
Early screening for kidney disease is very important because usually when you find out about it or you feel ill, you'd have already been too far gone or you'd have been advanced. So it is better to know your numbers from early so you are able to prevent it from getting bad, right? And why we want to screen as well is because kidney disease itself is one of the leading causes of death now. Like the incidence or how many people having chronic kidney disease, that has worsened over the past couple of years.
Wow.
And because you don't really feel anything until it's too late, the earlier you check is the earlier you come to us and the earlier we can prevent you from getting worse.
So what are the tools? How do you test for kidney disease? How do you test?
No problem. So how do you test for kidney disease? Many persons might know their executive profile. Your executive profile does include that, but to give you the specifics, you look for your BUN and your creatinine. And you also test for protein in the urine.
Oh, okay.
So you do a blood test and a urine test.
Okay.
Those two things help us to know if you have kidney disease.
Okay.
But I will tell you a fun fact. If you're diabetic or hypertensive, chances are you are at risk for it. And if you've had a stroke or a heart attack, you're also at risk for it.
Wow.
If you have issues seeing through your eyes because of sugar or pressure, you are at risk for it.
Wow. Okay, last question.
All right.
Why is it important to highlight kidney health? You know, we mostly speak about prostate health, breast cancer, but you know, for kidney health, I like the fact, as I said, that KPH and other public health institutions are doing a lot this week. I want it to be ongoing because our kidney is really our vital in functions that helps to regulate the body or helps the body to function. So as I said, I just want, to increase the awareness surrounding kidney health. So why is it so significant? What's so significant about kidney health itself?
Okay, so to start that, I'll share a story as to why my platform with the Cosmos Queen coming from Mrs. Universe Jamaica is so important to me, and the platform is kidney health. I'll share a personal story. At KPH, my uncle was dialyzed there before he had died. My family currently suffers through kidney disease, specifically kidney cancer. So the reason why it's important to even talk about kidney health is that because it was under the radar for so long, many persons don't understand how deadly it can be, how silent it can be, and how costly it can be. We also need to speak about kidney health because majority or all of kidney health is preventable. So this is not a death sentence. If you can catch it quickly, you can fix it.
Wow.
So that is why we need to talk about it. Also, right up with heart disease, it's one of the leading causes of death right now in persons who have what we call non-communicable diseases. And if you look at how the world is now, more persons are not eating as well, they're not exercising as well, and most of those things that we'll use to prevent kidney disease are the bad habits that we have that propel persons into getting kidney disease. So if we can educate, if we can raise health literacy, then we're able to tackle this head on from early to reduce the numbers and help with the economy as well, because treating kidney disease globally is costly. So if we can prevent it, then we're able to reduce the burden both on the society, on the government, and on ourselves.
Okay, thank you so much to our beautiful Cosmos' Queen of Jamaica 2025. Thank you, Doc, and have a great day.
You too.
Okay, so we're gonna have our next guest joining us shortly, Dr. Badal, nephrologist at the Kingston Public Hospital. Stay tuned. We have our next guest joining us today, Dr. Badal, nephrologist at the Kingston Public Hospital. Good morning, Dr. Badal.
Good morning. How are you?
Thanks for joining us and for doing this on our live today to talk about renal health.
Thank you very much, and thank you for the invitation to be here this morning to speak.
Sure. My first question, how common is kidney disease in Jamaica, and why should Jamaicans be concerned about it?
Before I answer the question about Jamaica, let me try to give a little perspective how important or how significant chronic kidney disease is. Currently, worldwide, about 10 to 13% of the world population has chronic kidney disease, which is approximately 800 to 850 million people.
Wow.
So, when you bring it down to the Caribbean island and Jamaica, approximately 10 to 13% of the population in Jamaica has chronic kidney disease, which is approximately 1 out of 7 individuals
Wow.
may have chronic kidney disease. Yeah.
All right.
So it is very,
Very serious. Very serious. So on a ratio of 1 to 10, you know, like how breast cancer, you know, is one of the most deadliest form of cancer in women. For kidney health from 1 to 10, is it within that range
Yes,
in
it
terms
is-
of,
it
you
is-
know, a lot of Jamaicans dying?
Correct. It is 1 out of the worldwide, based on the non-communicable disease. It is at, I think, number 7. And if we don't do something about it currently, it will, they said by 2040 there, it may reach number 1 or number 2.
Wow, wow. Okay, the theme for this week is Kidney for All, caring for people, protecting the planet. That's a really interesting theme. How does this theme applies to our planet?
Oh, that's a very interesting question.
Yeah.
With our theme, World Kidney Day. If we realize that our environment can have impact on us, on our kidney, both directly and also indirectly.
Right.
So the direct impact on our kidneys are if we're not doing the proper things. For example, if you're a farmer, if you're not drinking enough water, the toxins around us can affect the kidney. However, how does that affect the environment? How does kidney disease affect the environment? Well, there are several ways.
Right.
One, we use a lot of water during dialysis. Yes. So we have to try to preserve water, correct? One patient may use approximately 120 to 150 liters of water per dialysis. That's a lot of water.
Wow.
So at the end of the year, approximately 80,000 liters of water is being wasted. Well, I shouldn't say wasted, being used during the process of that treatment. The other one is when it comes to energy. To use the machines for dialysis, we use a lot of energy.
Okay.
And because of that, you find that we have to find ways to reduce that amount of energy that is being used. So we are thinking about using more solar in the different units if possible. The other thing is a lot of waste in terms of biomedical waste, like the dialyzer we have to throw, the blood lines, the needles, the syringes. So it's a lot of waste, approximately 2 or more kilograms, I should say, of waste per dialysis. And this is the effect dialysis now has on the environment. So we have to find ways to try to not only protect the kidneys and promote health, but also we have to promote our environment also.
Right.
Okay, so
that's a lot to do.
yes, it is a lot.
Okay. You spoke about water.
Correct.
Right. But I want to know, what are some causes of kidney disease?
There are a lot of.
Because you spoke also about the environment, that the
Yes.
environment affects our kidney. So what are the other causes of, kidney disease?
Yes,
How can the persons get it?
We have a lot of causes of chronic kidney disease. But the 2 main ones are diabetes and hypertension.
Okay.
If you go to a dialysis unit currently, right now, you will find that 60 to 70% of the population on dialysis, they have either diabetes or hypertension.
Okay.
These are the 2 main ones. And in Jamaica population, Caribbean and worldwide, diabetes and hypertension is in a rise.
Okay.
And follow to that, we have things like autoimmune disease like lupus. We have genetic problems, for example, polycystic kidney disease, recurrent infections, taking certain medications can affect the kidney. For example, NSAIDs, we call them things, medication like the diclofenac, Brufen, so they can affect the kidney if we are not monitoring those things. So yes, there are much more, but these are some of the main ones.
Okay. How many patients are being seen or treated at the Kingston Public Hospital?
That's a very good question. Well, at the Kingston Public Hospital, this is one of the main hospitals in Jamaica.
Yes.
Currently, we are treating 88 patients. Fixed patient. They have dialysis twice a week. Patients.
Okay.
And we have a little waiting list, but yes, currently 88 patients are being treated currently at KPH.
Okay. How many dialysis units?
Machines, how many dialysis machines we have?
Right.
Currently we have 23 of them.
Wow.
But 18 are on the floor.
Okay.
In other words, we don't have space for the remaining, but the other remaining, we are using them as backup if in case a machine breaks down. Okay.
What lifestyle changes can persons make to protect their kidney health?
Okay. One of the causes, which I never mentioned of, or contribute to chronic kidney disease is obesity.
Okay.
Now, when it comes to treating or preventing chronic kidney disease, lifestyle change is very important. So I will speak about, for example, if you are obese, you have to lose the weight because obesity can lead to kidney problems. If you are diabetic, you have to ensure that your blood sugar level is well controlled, which means you have to monitor your sugar level. If you're hypertensive, you have to ensure that your blood medication is taken and your blood pressure is monitored on a daily basis so that you can control those risk factors, those factors that can lead you to chronic kidney disease.
Okay, final question.
Yes.
It's to our public, right?
Okay.
What is one message you would like Jamaicans to remember about kidney health?
I would also tell Jamaican people that kidney disease, it is in an increase. And as such, we have to do the right thing to protect our kidneys. So I encourage everyone to go to the health center, the private physician, the nephrologist, whichever, to do their screening,
right?
Check the sugar level, the blood pressure to ensure that they don't have any kidney disease. And one of the things you should know also is that chronic kidney disease is silent, but the consequences of chronic kidney disease or kidney disease is very loud.
Wow.
And the best treatment is prevention.
So early
detection is very
save
important.
lives, very important.
Yes.
Okay, that's it for today. I'm not sure if our viewers have any questions that they would like to ask for Dr. Badal. We're taking questions now. If not, then we will sign out. No questions. I was informed by our producer, no questions. So that's it, everyone. Thank you for joining us today on our live to speak about Renal Week. We hope that you all have learned something about kidney health and how important it is to take care of your health. Until next time, signing out. Bye. Say bye, Dad.